Isla Anak Leonard, and I'm currently working at the Sarawak General Hospital, Kuching, as a radiation therapist. Everyone is worried, so are we, but we take all precautions that we can. Also, we as a medical professional or frontliner, we have to be there for the people who are in need in this hour. It helps that we get special training to avoid infections, such as how to put a proper PPE, proper hand washing. So at the moment, we have a proper PPE in our hospital for all medical staff in handling patient positive COVID-19. So based on my previous experience, we do not live with our family, even with our spouse. Some have to live in isolation rooms, stay in a hospital. So during the earlier of the pandemic COVID-19, we are not allowed to go out from the hospital, but of course food and drinks are being supplied to us. This all experience make us realize that how bad is the COVID-19 pandemic during that hours. So in my experience, how we deal with the COVID-19 pandemic is very, it's very new to us, and we don't know how to handle our stress, our workload, and our family, our emotions. Our normal duty timing before is 7 hours, but now during the pandemic COVID-19, it shortened to 4 hours per shift throughout the day to avoid overexposure of the duration in handling patient positive COVID-19. When patient comes to us in a critical condition, we usually directly take them to the ICU ward, which is special for COVID-19 patient. But if patient is stable, we send them to the COVID-19 ward, just a normal ward. Whenever the patient comes, he or she will be attended by 2 nurses along with our doctor to our hospital. We cannot predict whether the patient is positive COVID-19 or not, as they come to us seek for treatment for radiotherapy. Radiotherapy is a cancer treatment which is using a high voltage of radiation to kill the cancer cell. So basically, one patient needs to complete the treatment within 2 or 3 months every day. So maybe some of them that they come to us on that day, maybe they might have been infected with the COVID-19, but we never know. We can't predict because we can't see the virus. There are some cases that patients didn't realize that they have been infected by the COVID-19, and some of them did lie to us that they have go outside of the red zone and come back with the virus without show any symptoms. We, staff who are responsible for the patients, we receive late information on the patient's swab test result. So once we get the result and patients have been identified positive COVID-19, so we have to immediately self-quarantine ourselves in the hospital, or some of us are not allowed to go back home to see their families, children or spouse. So this situation make our department become short of staff. Staff who are left behind need to cover all the workload.
Bila ibu boleh balik, bila kita boleh makan sama-sama, bila kita boleh pergi jalan-jalan.
That experience, based on my experience, it's very tiring that we have to prepare our new clothes every day. So we need to clean ourselves after handling patient COVID-19 and clean ourselves before heading home. Being part of a frontliner is a very challenging task. We have to deal with their emotions beside handling radiation treatment routines and so on. To be honest, me myself was very stressed before, especially when we have to use the PPE all the time, all day during working hours. So it's during the working hours when we use the PPE, it's very hard to breathe while the sweating, and it's very tiring actually. After removing the PPE, we are required to shower using chlorhexidine 4% of body wash soap. Actually, this soap it can make our skin very dry and cause hair fall. So imagine when we need to use the soap 5 times a day. Contact tracings becomes big challenges in Malaysia. Ever since COVID-19 cases started surging over the few months, a few groups in Malaysia have blamed the inefficiency of contact tracing system that we have implemented. I personally dispute this view because actually our government and frontliner has doing more than enough. It is just a matter of our society, how they carry themselves out there, how they're taking care of themselves, their families. So in fact, our society nowadays willing to take risks of their life in order to living a normal life like before pandemic. Actually, our tracking system is very effective. Start from the earlier pandemic, we can see how government has stopped the entry of the outsider into our country or our state, even though this way can make a huge impact in our economy, especially in tourism sector. As we all know, Malaysia has created a digital tracking system that we call MySejahtera. It has been used widely in Malaysia especially. So this is the way how our government connect with his people. And this digital tracking system also give us the right information regarding COVID-19 that has been published in the apps. As we all know, Malaysia has created a digital tracking system that we call MySejahtera. It has been used widely in Malaysia especially. So this is the way how our government connect with his people. And this digital tracking system also give us the right information regarding COVID-19 that has been published in the apps. And on the other hand, our hospital itself has conducting very strict restriction and controls to trace any person who are possibly being infected with the COVID-19 virus. For example, no visitors are allowed in the hospitals, and all appointments have been conducting via phone calls, and medications also delivered to the house and by drive-through in the hospital also. All this effort need time sacrifice from all medical staff and frontliners to avoid the spreadness of the COVID-19. Aren't we doing more than enough? In our hospital, the patients, when the patients arrive, the nurses will conducting physical examinations and conduct interviewing on the patients to get the right information before allowing them to enter the clinic. So all the informations will be include if they got any symptoms, have they met any close contact with the index cases, and how they met, and how long was the meeting. So we need to ask the patient's latest result swab test before allow them to enter our hospital. Absolutely not, because each of us has our own responsibility. So as a frontliner, we are directly involved in managing of COVID-19 such as treatment, but as a society, as a community, you are fully responsible in prevent the spreadness of the virus. So as a society, they need to take care of themselves by staying at home, wearing masks, practice hand hygiene, and follow the government orders such as social distancing. Actually, society have a huge responsibility compared to the frontliners. Because frontliners just deliver a treatment, a medication, but in order to survive, it all depends on the person antibody in fighting the virus. So to simplify, responsibility is start from our community. The vaccine itself will help to protect you by creating an antibody, the immune system's response, without having to experience any sickness. Once you get your first shot, your body will begin to produce antibody to the coronavirus. So this antibody will help your immune system to fight the virus if you happen to expose to the coronavirus. So this vaccine will helps to reduce your chances to get the disease. When you get vaccinated, actually you are protecting yourself and helping to protect the whole community. When enough people are vaccinated in the community, it slows down the speed of the disease because COVID-19 can spread quickly and widely. It is true that you still can become infected after being vaccinated, but once more the population is vaccinated, those chances are further reduced. We are still learning how vaccines will affect the spreadness of the COVID-19. Until we know more about how vaccine will affect the spreadness, people who has been vaccinated still need to taking more precautions in public, especially in crowded areas. Still need to wear the mask, hygiene, and social distancing. So right now there is just one thing that I want. I want people to stay in their houses. Only when they stay in their homes, so we will be able to go to ours. And to the community, we do not ask much, just prayers and encouragement for us. It is our responsibility to break the virus chain. Just obey the government's order, stay at home so that we can go back to our normal life like before. Just be responsible to yourself and to your family members. I know we are struggling in our own difficulties, but just try to adapt with the new normal by wearing masks, practice hand hygiene and social distancing. All of these are very new to us, but COVID-19 is a very aggressive. It is a silent killer. It is real. Just be honest with us, especially in giving information. Don't manipulate the information and give the wrong phone numbers because you don't want to get caught. But did you realize that this behavior are putting our frontliners, our medical professionals in a dead way? So cooperation is the key. So I hope the community, the society, you keep up to date with the right informations and keep educate yourself and educate your family members on how dangerous is the COVID-19 it is. So last but not least, stay safe and get vaccinated.
We are a nation at war with invisible forces. The situation we are now facing is unprecedented in history. So my dear brothers and sisters, and the children of this beloved country, we are not perfect, but we are doing the best we can to pull through this crisis together as one nation. And God willing, we will come out stronger when this crisis ends and the dust settles, inshallah.